Hey everyone, and welcome to the channel. Today we're talking about a topic that affects many expectant mothers: gestational diabetes. It can sound a bit scary, but with the right information and care, it's completely manageable. Let's dive into what it is, who's at risk, and how you can have a healthy pregnancy even with this diagnosis. So, what exactly is gestational diabetes? Simply put, it's high blood sugar that develops during pregnancy, usually in the second or third trimester. Pregnancy hormones can sometimes interfere with how your body uses insulin, which is the hormone that regulates blood sugar. When this happens, sugar can build up in your blood. The good news is that for most women, this condition is temporary and goes away after giving birth. One of the trickiest things about gestational diabetes is that it often has no obvious symptoms. You might feel perfectly fine, which is why screening is so important for all pregnant women. Your doctor will likely recommend a glucose tolerance test, usually between 24 and 28 weeks of pregnancy, to check your blood sugar levels. Now, you might be wondering if you're at a higher risk. Certain factors can increase your chances, like having a family history of diabetes, having PCOS, being overweight before pregnancy, or being over the age of 30. If you had gestational diabetes or a very large baby in a previous pregnancy, your risk is also higher. But remember, it can happen to anyone, even if you have no risk factors at all. If gestational diabetes isn't managed, the high sugar levels in your blood can cross the placenta and affect your baby. This can cause the baby to grow much larger than average, a condition known as macrosomia, which can complicate delivery. After birth, the baby might experience low blood sugar or breathing difficulties. Long-term, it can also increase their risk of developing obesity and diabetes later in life. But here's the crucial part. Controlling your blood sugar significantly reduces all these risks, paving the way for a healthy baby. So how is it managed? For most women, the first line of defense is diet and lifestyle changes. It's not about deprivation, but about balance. Focus on eating small, frequent meals throughout the day to keep your blood sugar stable. Pair your carbohydrates with protein and healthy fats. Choose whole grains, lots of non-starchy vegetables, and lean proteins. It's also important to avoid sugary drinks, sweets, and refined carbs that can cause sharp spikes in your blood sugar. A simple 15-minute walk after meals can also work wonders, as long as your doctor gives you the green light. If diet and exercise aren't quite enough to keep your blood sugar in the target range, your doctor might prescribe medication or insulin. Please know that this is very common and safe for both you and your baby when managed by your healthcare team. As you approach your due date, your doctor will keep a close eye on your baby's growth. If the baby is getting too large, a planned delivery might be discussed. The great news is that after you deliver, your blood sugar levels usually return to normal very quickly. Your doctor will recommend a follow-up test a few weeks after birth to confirm that your blood sugar is back in a healthy range. Gestational diabetes can feel overwhelming, but you are not alone, and it is manageable. With teamwork between you and your healthcare provider, you can have a healthy pregnancy and deliver a happy, healthy baby. Thanks for watching today. If you found this video helpful, please give it a thumbs up and subscribe for more content on having a safe and healthy pregnancy. We'll see you in the next one.